All right, we are live on this day 320 of a 15-day lockdown. Um, of course, this is the truth, the facts, and the events as they did in fact happen, and how to end the COVID psychosis. The problem we're running into, and it always happens this way, I mean, especially during recent history, is you've got management team A and management team B, and rather than try to solve problems, they work on a narrative. And so what this is doing is we're going to completely run that narrative over in the manner in which it deserves. So going back to February 2020, there was this thing called the Diamond Princess, which was a cruise ship, which was a preview of the inevitable. Now, what was the inevitable, you ask? Well, it was a disease where half of the people will not get it. 20% will be relatively uncomfortable, but they'll survive, and 1% will have a really bad time. And of course, as they were saying, this was a disease we would get when, not if. So let's just go to some settled science here, or at least, so they say. This is what happened. This is exactly what happened on the Diamond Princess. This is what happened on every cruise ship. This is what happened on the USS Teddy Roosevelt. This is what happened everywhere. We are a big, gigantic cruise ship. And there are a lot of reasons for this. We're not necessarily going to go into all of those, but we will talk crap later on. And no, that's not a joke, but it's a major part of the reason. So, of course, what we have going on here is I see a technical malfunction. Let me see if I can get back here. So here we go. How this would spread inevitably was in the public domain as of February 2020. So in other words, we knew it would happen, and it was inevitable. And of course, looking back, we kind of know how we got here and where it's going to go. So do all the safety theater you want. This is what happens. So, of course, we confirmed, as of November 2020, that the Diamond Princess was settled science, and, of course, courtesy of your CDC overlords. And, yeah, that's what they're saying. And, of course, we knew virus was going to virus, even before we noticed its presence in 2019. Of course, without a media trying to scream at you the whole damn time, it's kind of hard to know something's really up, isn't it? So, of course, yes, they were better than social distancing on the Diamond Princess. They were isolating. Yes, they were wearing masks. Yes, they all still got it. Yes, by March 5th, it was 3,618 tests, 696 positives, including 410 quote-unquote asymptomatic cases. So, let's back up a sec. An asymptomatic disease? You see, that's pretty interesting because the definition of a disease has always been a illness of people, animals, or plants caused by infection or failure of health rather than by an accident, and it has this magical thing called symptoms. So, the definition of disease from the Merriam-Webster dictionary, which I'm sure is some sort of conspiracy theory now, is a condition of the living animal or plant body or one of its parts that impairs normal functioning and is typically manifested by distinguishing signs and symptoms. Okay? If you have no symptoms, you have no disease. Let's just drop it right now. Here's the facts. This is what a disease is. It has symptoms. It's a crucial element. All right. More definitions. COVID-associated death. And this is from the state of Connecticut, and every one of these states is going to do the same thing. Every government's pretty much doing the same thing. COVID-19 associated deaths involve persons who tested positive for COVID-19 around the time of death confirmed, and those who were not tested for COVID-19 whose death certificates list COVID-19 disease or SARS-CoV-2 infection as a cause of death or a significant condition contributing to death, in parentheses, probable. Okay? So this is the definition of a case, an infection. This is per CDC, per the Council of State and Territorial Epidemiologists. So as you see below, also highlighted under the section A2, is a positive, a PCR positive. That's it. That's all you need to get there. And there are a ton of them. And that's exactly what's been going on. So we are chasing cases which are also known as PCR positives. That's what we're doing. That's our measuring stick. So comorbidities. These are other conditions operative at the time of death that contribute to death. Now, the CDC has done a wonderful job listing all of these other comorbidities. If you'll notice, one of them is influenza and pneumonia. And of course, let's just conveniently break down the numbers, shall we? As of the weeks of January 4th to 23rd, 2021, per CDC, COVID comorbidities included, 156,203 had influenza and pneumonia, okay? 31,924 had sepsis, 55,198 had diabetes, 13,778 had Alzheimer's, 38,381 had vascular and unspecified dementia, 12,850 were suffering from intentional and unintentional injury, poisoning, and other adverse events. Okay? These are, quote, deaths with confirmed or presumed COVID-19 coded ICD-10 code U07.1. So, thus our measuring stick is forged. A PCR positive will do. We are not on a quest to actually stop sickness. We are on a quest to stop PCR positives. This is the standard of the NIH CDC governor prescribed care is still stay at home and die and wait for a shot. Of course, the costs are all relevant. Patient outcomes for things and conditions other than COVID-19 are entirely irrelevant. And 321 plus days, I mean, you might be looking at this tomorrow after. This presentation is basically how we've measured up. This is what happened. And so, here we go. So, March 6, 2020 was the press started with, we all gonna die. Fact box, how we die, coronavirus in perspective. Well, of course, we all do die, and that is a condition of life. That's the last one is death. Look, death is a fact of life, but, you can see how the hysteria started really pumping up about March 6th. Of course, you had other headlines. This is from March 13th. COVID-19 is scary enough without the scaremongering. So, as they were writing at the time, as for the million expected deaths, that was, a lot. The New York Times reported that one of CDC's modeled scenarios found that between 200,000 to 1.7 million might die during the epidemic, with 2.4 million to 21 million people requiring hospitalization. A million deaths falls into the worst case scenario category, not the expected number. All right? So March 13th, 2020, we march on. And this is when they start the death of projectificationing, where they keep throwing these numbers at you, and they just keep running up this tally. And no, it's no different on day 320 of the 15-day lockdown. So, March 16th, 2020, 15 days to flatten the curve. As the Donald had said, this is a very bad one. And of course, this is where you got the stupid little postcards in the mail, which said, 15 days, stay home to flatten the curve. And of course, McCurve has been hammered and hashed, and we've been beaten senseless with this. And of course, as it was written in this article, Fauci called the 15 days a trial period for the guidelines to be reconsidered. It isn't that these guidelines are now going to be in effect until July, he clarified. Right, you're so full of shit. How'd that work? And of course, the governor, he got right on it. We do McCurve, Connecticut style, and as I call it, lamenting. So, of course, March 14th, this is when all the daily orders started coming out. And it was just, life just got more fun from there, didn't it? And of course, the governors of New York, New Jersey, and Connecticut, they just got together and said, we're going to make ourselves basically a country. We're going to set policy. We're going to restrict trade among the states. We're going to restrict travel. And we're going to slave over a hot microphone every goddamn day until you're blue in the face just listening to it. So that's when they started going crazy. And obviously, it has not stopped. We're on day 320 of this, by the way. And of course, Mavents. Y'all probably remember the screaming about Mavents. But of course, there's a lot more to it than events. You see, people just weren't thinking things out. Like the annoying, people, call them nurses, who are kind of pointing out what good are these vents going to be without staff and other things necessary to run said vents and jam them down to people's throats. And of course, the same events people knew that these vents would actually kill somebody. And kill a whole lot of people. And they didn't just know that, from the Wuhan data, which we'll get to later. They knew that years ago, and still didn't stop them. Didn't stop the Donald from saying, I'm going to use the Military Defense Production Act to make my vents happen. Because vents, right? And so, of course, what happened in Wuhan? When 2% of the people you do something to survive, that is probably an indicator to not even think about doing it. We knew that back then. I remember my wonderful congressman here couldn't bring that up at a Facebook town hall, could you? Because everyone's yammering about events, but if you say, stop, wait, let's rationally think about this, you might run afoul of someone screaming at you. But, life is difficult, and we'll get to that. But I did my job. He didn't, but I did. So there we go. So the math of your 15-day nothing burger, basically, it's moot by day 320. And as you see, you've got like the R naught of the disease as it was, projected to be at that time. So as you see by day 19, if you start with 1, by day 19, you've got 27 infected. Then the next day it's 81. Then the next day it's 243, 729, 2,187. At day 121, you've infected 1.7 million people, haven't you? And by the way, we'll get into the whole when did this nonsense start and when was it implemented. But that's interesting to kind of keep that in the back of your mind, and you should. So, surprise! May 2020 New York data on said 15-day nothing burger. Most everyone got it at home. Shit. Literally. But we'll get to that. 66% of the people, according to the state of New York, as of May 2020, got it at home. And of course, 18% through nursing homes. I don't. There's no restaurant data here, but it's really small, and my understanding was it's supposedly 1.73% of the spread. But screw you if you want to eat a meal in peace and quiet, right? And of course, Birxbox, she was out there saying 200,000 would die if we do everything almost perfectly. We did. We did do everything more than perfectly, and we've got the results that went sideways to show it. We'll get to all those results later, too. And they're not just COVID results. So, your March 30th, 2020 update is your essential superhero vector. Hint is that's how it fucking spreads. Okay? It spreads through hospitals and nursing homes. That's it. Hasn't changed. 320 days later from the 16th, still happening. No one's taking, well, I mean, a lot of people are taking a look at it, but, really screws up the narrative, doesn't it? You wouldn't want to lock all the essential superheroes into healthcare facilities, would you? I don't know. That might stop the spread. So why does it take essential superheroes to spread the disease? Well, they go home after their shift. They're locked in the home with its other inhabitants, and they touch the same surfaces, and the truth is and has kind of been, well, crappy. What do we mean? April 2020, silent but deadly. Yes, that month we were ordered to stay home and smell the interior design roses of our roommates. Okay? This was known in April 2020. I mean, it may be a little further, but we'll get to that. Maybe a little sooner even. Oh, look, May 2020, COVID-19 virus found in stool may be infectious. May 27th. I mean, we're not, coming out with any toilet lid orders or hand washing orders, are we? Because, I don't know, that might be effective. We wouldn't want to do that, would we? So, genius governor has shock and surprise that people are getting it at home. What the hell do I know? I'm not a governor, and apparently that's why, because I know better. July 16th, 2020, we knew the truth was crappy, but did we earlier? It turns out, we Probably might have, but, I guess we'll see. August was also a crappy month for COVID-19. These articles kept coming out. Coronavirus fecal transmission. Why flushing the toilet might spread the virus. I don't know if anyone's making a connection there. Same crap, a different month. That was October 2020. Medscape article. High level of SARS-CoV-2 found in patient toilet staff in public areas and hospitals. Well, the truth is just, oh, look at that. Wait, you mean we knew the truth was about crap the whole time? Yes, we did. And we knew it in February 2020. Fortune, one of these articles people like to quote, like, oh, look, I read Fortune magazine, I'm smart. Well, did you read this one? Headline, fecal transmission may be responsible for coronavirus's rapid spread. We can't recall that because that would, throw some crap on the narrative, wouldn't it? Probably the crap spreading COVID-19. So what about the masks? Well, first they said, don't wear them. Then they said, we recommend wearing them. Then they said, we'll fine you, and should shout you down for not wearing them. And then the data didn't show the desired results, but we'll follow that science too in a bit. And now Fauci says, wear 2 of them, even though the data doesn't show any morale improving with repeated governor-mandated beatings. Okay, government says, don't buy masks. So before you sit there and say they never said that, yes, they did, and they were actively saying it. Even the Surgeon General himself was saying it. And he also said, you might actually spread COVID by wearing a mask. How about that? Of course, this is COVID, SARS-CoV-2 by the numbers. If you want to pause the video, you can, but this actually tells you how small SARS-CoV-2 is. In other words, mosquito meets chain link fence. And I don't know about you, but maybe the science says chain link fences stop all the mosquitoes, or even most of them, but what do I know? A diameter of 100 nanometers, that's real small, okay? And by the way, the reason that masks work for tuberculosis and not COVID is because tuberculosis is a lot bigger. It's a bacteria. So that's kind of like trying to throw a baseball through a chain link fence. Masks work for tuberculosis. Size matters. You want to say, what do the settled science believers say? Well, there were multiple studies, this is just one of them, where they tried to isolate COVID in the patient rooms in a hospital in Iran. And what they did, they didn't just, sample the air, they went right to the fucking tube coming out of the patient's mouths. So, didn't show up. Kind of hard. But hey, of course, there's been a lot of question and debate in the scientific community, because why the hell would anybody want to, discuss science? Because isn't it settled? It's not this perpetually changing process where people have to experiment and share the results and whatnot. Who knew? All right, so what actual scientific process sounds like? From that last slide, that letter to the editor there read, Zhang et al. Conclude that wearing a face mask in public is the most effective means to prevent transmission. This conclusion is scientifically highly questionable. First, the number of epidemic curve examples is small. An explanation of how they were chosen is lacking. Second, the evaluation is flawed by not taking into account where the majority of transmissions took place. And of course, third, the authors assumed that face covering was the only effect and did not control for or analyze confounding variables. It is very unlikely that social distancing was the same in all selected epicenters. So how about that? Variables and control. But what the heck? I guess science is different now. And wait, there's more. 40-plus-year-old settled science, an audacious study entitled, Is a Mask Necessary in the Operating Theater? Now, you're probably thinking, I bet you they took off the masks and all the patients died with infection, and the infections went through the roof. Actually, they were going to shut this thing down if that happened. So, what did happen? Infections went down. They didn't go up. And they have data over the course of 1976, 77, 78, 79, and 80 when they ran this thing. Okay? So, that's science. Oh, but wait. There's more. Of course, they've documented probably one of the things that makes mask wearing a lot worse, which, by the way, the Spanish flu, let's go back there. There isn't a slide for that. Even His Highness Fauci had noted that they didn't have antibiotics back then. That's what made the Spanish flu so deadly. Here we've got a study documenting that, hey, masks do transmit nasty stuff. And of course, the same thing is showing up here. That not only do they transmit stuff, but they just don't work to stop the spread of the common cold. What are we doing here? I mean, this is not a new thing. I mean, if anything, the science is settled that it's unsettled. And on a good day for the screamers. So, this is what actual science looks like, by the way. Just to give you an example, hint, you do a study where you give the reader enough information where they could replicate your experiment, okay? And this particular one, it was used as an exhibit in court, one of many, I might add, where somehow actual studies are trumped by the New York Times, but what do I know? But this, you've got a diagram of how they did it and how they got the results, and you could look this study up online, at your leisure, because there's way too much to go over. All right. So how did the settled science on masks and social dimwitting play out? Well, here we are. I pulled this yesterday. You have, all these people. A lot of people ended up in the hospital. It's just they said, do this, and this won't happen, and it happened, okay? There is a saying that goes, correlation does not mean causation, but certainly lack of correlation certainly discounts causation. And that's what you're dealing with. Now, let's get audacious here. Let's compare Connecticut, the golden child, whose governor is so great and does so wonderful, to Sweden, which according to the screamers should be a Sweden-shaped casket with 10 million people in it by now. As you will notice, here are your curves, my curves, all right? Sweden does better for the most part, but basically ends up at the same damn place. Let's do something even crazier. Let's compare Connecticut to Japan. I know that's unfair, but here you go. We have Connecticut's 182 deaths per 100,000 to Japan's 3.7. I know, you're probably going to be like, and a lot of people are like, Japan didn't lock down hard enough. Everyone's going to die. Well, what the fuck, I ask you, and I say that intentionally because we've done 320 days of this bullshit. All right, let's compare Connecticut to Japan versus Malawi. All right, Malawi is, it's a great place to go if you want to be poor and impoverished and not have critical infrastructure. For some reason, Malawi has 3.21 deaths per 100,000. Now, I'm going to tell you something about Malawi that's different than Connecticut. See, in Malawi, they take this thing called ivermectin to rid themselves of parasites, which has actually shown efficacy in dealing with COVID-19. And it's available everywhere. You don't even need a prescription for ivermectin. Yeah, go figure. It's a theory. It's a good explanation. I know there's been a lot more data coming out on ivermectin, but we'll get to that running into my shot later. Of course, fine. Just confirmed infections, Connecticut versus all other states. All right? So, Connecticut, 52.49 infections per 100,000 compared to the rest of the damn United States of America, 27.72. But Lamont's doing a good job, right, guys? Come on, the data is not showing you that good job. It's not showing you the essential superhero that he's purporting himself to be. All right, let's just follow the science and compare Connecticut to places that didn't go nearly as far as we did or didn't do anything at all. Again, Malawi is kicking us silly. Somalia's doing better. I mean, what more do you want? I mean, what we compared it to Sweden, South Dakota, Malawi, and Somalia. I mean, I know that was fairly mean, but I did it, and this is where the numbers are. You can do it yourself. This is from the screamers at IHME, by the way. So, suck it, Bill Gates, MD. Your science didn't pan out, did it? Now, this is from, of course, I pirated this from Tom Woods' talk, The COVID Cult. And the way he does it here is, yeah, obviously the COVID went away. Points out, here's where they required masks. And you see the data showing you otherwise, that it's not fucking working. All right, maybe you need another country. Maybe you need Germany. All right, Germany requires masks. when the trend was already going downward. You can't say that it caused the downward trend because it was already going downward when you implemented the stupid thing. All right, but yeah, everywhere. How about that? Oh, how about let's just, as Tom Woods did, compare all the countries in Europe that required masks to the ones that didn't. How about that? Why are these curves through the? Why are they parabolic? They're through the roof. They're on their way to the moon. How about that? All right. Let's compare the Czech Republic to Sweden, as he did in the talk. The COVID cult, by the way, watch that. It's great. But of course, here you see Sweden, everyone's dying of COVID, and for some reason the Czech Republic's just doing peachy keen, isn't it? All right. So what conclusions did we arrive at here? 321 plus days of data are in on things that did not work. All right. Lockdowns didn't work. Sector rules didn't fucking work. Masks didn't work. Screaming didn't work. Travel restrictions didn't work. Capacity limits didn't work. And school closings didn't work. And neither did isolating your elderly grandma so she can't play bridge with her friends. That not only didn't work, it was actually inhumane and kind of fucked up for you to do, wasn't it? So, things that do work, you can look up the Math Plus protocol. Early intervention. You don't let people just stay home and get sick and die. Steroids, anticoagulants, ivermectin, vitamin C and D. Yes, of course, under doctor supervision. So before you type in the comments or whatever, you're not a doctor, derp or derp. These guys are doctors, and they actually have treated COVID patients. And you know what? They're starting to get that ball moving toward a more sane kind of future. And thank them, by the way, when you get a minute. So why haven't we tried what works, and why do we keep up with the lockdowns? Emergency use authorization for the vaccines goes out the damn window, because in order to get emergency use authorization, you have to submit paperwork to the FDA that says, we've got nothing else, and we're screwed unless we do this. Okay? So the minute you start accepting that there are things you can do that don't involve crazy measures, there you go. Mashot, they got to pull all the doses of Mashot. They got to all come off the shelves. That's why they'd never admit it. And there's a lot of damn money invested in this. So, speaking of money, federal emergency dollars flow to the states, and if you just say the emergency's gone, which, by the way, the governors of Idaho and North Dakota both admitted to the press that they're not going to stop the emergency because they would stop the fucking cheddar from flowing. Now, I sound angry. I am. You should be too. And of course, changing the PCR measuring stick would reveal the error, even innocent error with substantial public outrage in the offing. So when you run the PCR test more than, say, 25 cycles, you're not going to basically find viable virus. So the PCR test is a measure that's qualitative. It's not quantitative. Now, the difference between qualitative, it's either a yes or no question, did we detect the virus? Qualitative would be, did we detect a viable virus, not dead RNA? So the narrative at this point, in between the testing scams and the federal bailout scams and the vaccine scams, it's not a science scam, guys. Don't even try to go there. It's a money scam. That's what it is. It's about the dollars. The narrative is financially too invested, and the costs of the damage are already catastrophically high. So, the picture of a mere 3 months into fiscal year 2021. This is from, by the way, the source is the United States Treasury. I don't know how more close to the horse's mouth you can get here. But you see, just in a month, we're running 144 billions in deficit. And just for this fiscal year alone, which began in October, mind you, we are running a $573 billion federal budget deficit. Yeah, you print that, and we'll get into that disaster in a bit. And of course, fiscal year 2020. So if you guys want to just tell me the Republicans are fiscally conservative, I'm going to tell you to shut the fuck up and go fuck yourself. Why? I have 3.132 billion reasons why. That is the total budget deficit. I mean, they were practically walking money out of the Treasury on pallets to pay for this lockdown nonsense. So you can't do that. That doesn't end well. Well, we'll get to the costs later. So things we knew in July 2020, and yet we did not stop. Pandemic may cause 40 million Americans to lose their homes, but who needs a home anyway? I mean, does shelter have anything to do with health outcomes? But wait, I'm not a doctor and Bill Gates is. That's right, no one needs a place to live. And of course, if you want to measure how many people are actually unemployed, look at the labor force participation rate. This is from the Bureau of Labor Statistics, and it's real bad. And not only is it real bad, it's been consistently worsening since, like 2000. It's not good. So this COVID thing kind of comes at a convenient time where the system was kind of blowing up anyway. But hey, this virus is a magical thing, isn't it? So, how much money did we print for this national prison experiment? Well, if you want to know how much money is in the money supply, that's called M2, and it's published by the Federal Reserve. So you see over here, this tiny, tiny bar is January 2020. That's how much money is in the money supply. Okay? And we've gone all the way up through October. It's real bad. We have, that's a good at least 25, percent. That's going to show up in prices. And, you think grandma's safe now? Wait till she has to eat cat food. That's where we're going. Cancer patients. Cancer specialists, of course, worried about screenings getting deferred due to COVID-19. And that's, July last year. A lot can happen with cancer. 3-4 months is critical. But what about 320 days? Who gives a shit as long as grandma's not dying of COVID, right? And of course, we've got lockdown suicides, because a prison experiment is that happy. Those deaths of despair, they're kind of, super critical, I guess. Hey, but, as long as they're killing themselves, at least it's not COVID. Well, I don't know, but we already went over that, didn't we? Some were accidents and poisonings, but still, COVID does it. We have these secondary annoying prison experiment effects. One is denied and substantially delayed hearings in DCF, CPS, criminal and voluntary commitment cases, because who in the hell needs due process, right? It's only their liberty. I mean, that might have some health outcomes too. Elderly and child abuse from isolation. Permanent loss of a year of education for many children. I gotta tell you, if you're watching this years later and you were a kid and you didn't get to see your friends, you didn't get to, do normal shit, I'd be like, fuck you, Mom, fuck you, Dad, for putting up with that, because that was super messed up. And of course, permanent small business closures, because 320 days of taking a punch to the gut, revenue-wise, that's a mathematically impossible ask. But who cares? At least we've got Walmart, right? So what is this then? This is Munchausen by proxy by executive order. Everyone is being treated as if they are sick. And it's messed up, and it's actually a psychological illness. So it is in fact a Stanford prison experiment, and the guards are the Karens, by the way. You might have noticed that already. And of course, it's a certain road paved with too many good intentions to further dystopian ergonomic hellscapes of increasing complexity and scale. That sounds like fun, isn't it? But wait, there's more. Secondary annoying prison experiment effects. You're going to have much higher insurance costs because, 2020 was a bad year for premiums, and how in the heck do you even gauge costs when governors can just shut everything down? You can't even plan like that. How are the underwriters going to shop these things out? So you like your quote from Geico now or wherever, get used to a price hike, because it's coming, and you're going to take it in the wallet because you put up with this. So existing infrastructure that was definitely not fixed, it's going to take a lot longer to get fixed. Got a lot of crumbling bridges and dams that are rated like a D on a A to F through scale. I mean, isn't that? Oh wait, that's bad too. And higher shipping and everything else costs, because shipping is what makes the world go around. So do your best to disabuse yourself of blissful unawareness of the global shipping industry now. It's time to start learning some shit, because you're in the need to know. And of course, you didn't think we were done yet, right? You didn't think this bill was enough. You didn't think the invoice for the prison experiment was high enough. How about the loss of life years, reduced health spans, and life expectancy permanently? You see, when you do these psychological things to people that have permanent effects on their personalities in isolation, via a prison experiment, what do you think that's going to do? What do you think that's going to do to children that haven't even been born yet? Or never mind the permanent and semi-permanent atrophy of job skills and work habits of those put out of work indefinitely. Because you see, when people are out of work beyond a certain period of time, it is far less likely that they're ever going to find work again. Look, that's a fact of life. And of course, you have the permanent loss of investors and business opportunity, because who in their right mind would invest in an economy that the governor could just shut down at the drop of a hat? That would be, I don't know. I don't know how the Motley Fool or Investopedia would characterize it, but they'd probably use the words fucking stupid, because it is. So more things you've paid for. Isn't enough, is it? This bill is just, it just keeps going. Church closings. I mean, if that's your thing, there's going to be a lot of, I know the Catholic Church is, yeah, that's only mine. But yeah, there's going to be closings. So church, synagogue, temple, whatever, they're closing. More of them are closing. You've got environmental damage that results from not maintaining infrastructure. Case in point, by the way, is the CDC's own building in Atlanta, Georgia. Legionnaire's disease broke out because, they just didn't keep up. Everyone's on Zoom. They're doing the whole tele-social dimwitting thing. And, of course, there are physiological effects from a sedentary lifestyle when we say stay home and be afraid. What do you want? So not only taking that big cortisol dump, which fucks up your immune system, but you're not moving. So we're also seeing an increasingly diminished investment because of fear what governors will do. So, yeah, look out. It's coming. But wait, there's still more. There's still more that you've paid. There's still more cost to all this nonsense. The college credit card and mortgage debt bubbles will pop. You made it certain. So make way for the bloodbath, boys and girls, the financial one, that is. Fewer people will start families, have children, and buy cars. All that cool stuff you do when you have a future. Well, when you got 49 governors taking it away, you kind of just disrupt that whole, try to save for tomorrow sort of mindset. And of course, there's increased confusion and oppressively selective enforcement, where you basically get to protest so long as your governor agrees with you. That's kind of messed up. And you think there's a problem with funds for social safety net programs like Medicaid unemployment now? Ooh, you ain't seen nothing yet. It's going to get real bad. Oh, you think that was it. That was not it. Here's more stuff you threw out with this whole safety theater and hysteria. Medicare, gone by 2022 to 2023. The program was already on a death spiral before COVID showed up. But now, that's what happens when you got a program that spends $5 for every one it takes in. Hospital closures. No, they're not swamped. They're underwhelmed with the elective procedures not happening. Those things that pay the bills of the hospitals that keep them open for the emergency patients. State pension funds. If you have a state pension, enjoy that while it lasts, because you're fucked because you put up with it. Higher state and property taxes, because those benefiting from the proceeds won't give up those benefits quietly. And then there's inflation. Yeah. So this is how you got there and what not to do. And you're probably thinking, but I know, let's rah-rah Democrat, Republican and vote our way out of the problem. Need we remind you, there were no WMDs in Iraq. The Gulf of Tonkin was declassified as not North Vietnam's fault. That was in 2005, by the way, where they declassified that. The war on drugs never fucking worked. How do you think they're going to deal with the war on COVID? I don't know. The Patriot Act caught 0 terrorists and has been renewed since 2001, even by the Donald. And yes, the TSA only groped you and stopped 0 terrorists throughout its entire fucking existence. Now, mind you, the TSA was created so the airlines didn't have liability. That's it. It had nothing to do with terrorism. So, suck it. And here's some more cold, hard truth on Republicans. Masks are patriotic, so spoketh the Donald. All right? Deal with it. That's July 20, 2020. All right? That was the state of affairs. So, on the Donald's like, yeah, April 2020. Let's go liberate these states. When in the hell is that going to happen? I don't know. Any time would be great. The Q people were just telling me, like, I don't know, Dan, just wait for this day. Just around the corner, this is when it's going to happen. Bullshit. It's a scam. And of course, no, the Donald did not send Attorney General Barr to save you. I was actually trying to save you. You see, myself and, good people by the name of Sean Murphy and Robert Barnes, we sued. We were waiting for the reinforcements. We didn't just wait for the reinforcements. We asked for them. And the Donald didn't send any. So, more likely stories were told on January 6, 2021. Our economy is a rocket ship up. It's just $26 trillion. Give them a few more bucks. We'll pay it back. That's a quote, by the way. And then, of course, there was the big whopper. I'll be right there with you at the Capitol. Yeah, how'd that end up? So, trust the plan. So spoke it the Republicans. Looks like a pretty shitty plan, doesn't it? And sometimes you just got to call a shitty plan as the shitty plan that it is. So, of course, yep, sure, there are plans to end the lockdown. Yep. Oh, crap. This is, man, these governors are just in everything. They're shutting down interstate youth hockey. I mean, talk about micromanagement. And wait, there's more. Just another extension. You know, we're going to go to April 20th. So this, come on. Then, of course, the science has always clearly been followed. Yeah, I don't know. The guy's was only the head of the CDC. What the hell does he know? He's a doctor. Lamont isn't, but Lamont's right. And there's more. Under the people who are going to say, but I know let's rah-rah Democrat, Republican our way and vote our way out of the problem. So no one went to jail for the 2008 crash or the foreclosure crisis. Actually, 2 of those motherfuckers were made Secretary of the Treasury, okay? And yes, AIDS was handled in the same scienceless way as COVID by the same Dr. Fauci and other people. Oh, you remember those Tea Party Republicans that were elected over the reckless spending? Yeah, did you just see those charts, or do you need to rewind the video and go back and see what that looks like? You know what? Let's go back. Let's take a look at what Tea Party Republicans fucking look like. It looks just like that. So, you want to trust that plan, you're playing with fire, my friends. And, just so you know, let's go back forward here, just to remind you of where we are with this rah-rah Democrat, rah-rah Republican thing. It's the same bullshit, different shovel. So, maybe there's more. Oh, look, there is more. Here's your problem. By the way, it's the mob. The Democratic Party and the Republican Party are functionally like the mob. You know how the mob is designed to top down, to run numbers and rackets and such things? Well, trying to vote, register, affiliate Democrat or Republican is a cause of the problem, not the solution. And besides, you don't have 2 or 4 more years of irreparable damage to withstand. I kind of thought, maybe Medicare's maybe that might be a bridge too far for this rah-rah Democrat-Republican thing. And by the way, when you've only got Democrat and Republican, you basically have the winner and the loser, and then the winner gets to impose whatever the hell they want on the loser. And it's just 4 years of kicking the imposed upon in the testicles repeatedly. And that's what you get. You don't solve the damn problem. So when you walk into the mob, and you say, I'd like to use the mob to feed the poor and, clothe the poor and educate everybody, someone like maybe Vinny the Shovel's going to look at you funny and say, we're the mob. We make people fall funny. We're not into helping the poor. Okay? That's it. That's the damn truth. And by the way, we can go back. We could talk about the TSA. We could talk about Iraq. We could talk about the 2008 bailouts. We could talk about the drug war. We could talk about the savings and loan scandal of 1985. We could talk about, addled former Senator John McCain, who's complaining on the floor of the Senate that we were bombing Al-Qaeda. But the thing you got to realize, all this makes sense when you realize it's not one evil super plot, for doing all this stuff. It's a bunch. It's a orgy of special interests. Like, you take Iraq for just one example. The COVID, you've got the testing industrial complex, and you've got, the vaccine scam to exclude other available drugs and treatments. All right? There's a lot of cheddar rolling around. Just like there was a lot of cheddar rolling around in Iraq to pour all that concrete to never leave. So, that's what you're dealing with. Live with it. And of course, or you decide you don't want to live with it. So here's what you must do. Don't wait to vote your way out, okay? If you're a registered Democrat or Republican, stop that shit. Just stop it right now. It's not helping you. It's legitimizing your own oppression. And no, don't comply. Don't comply at all. And do sign on to the Declaration of Make Me Day, which starts February 10th, 2021. And no, do not ever wait around for someone else to be the first to do something. These things are really difficult, and they never work like that, okay? So, if, I don't know, we had George Washington's troops during a smallpox outbreak without shoes cross the Delaware River, I think he can take off the mask and get screamed at. I don't think that's too much of a thing to ask you to do. All right? So the bottom line is, it never works like things are just popular overnight, because if you wait around for that to happen, you're never going to make it popular, are you? You're never going to make the problem solved, will you? That's a fact. Things do not magically happen on their own. So here's what Make Me Day is in brief. Our hand has been forced. You want to talk about the Munchausen by proxy by executive order? That alone is a bridge too far, but we mentioned all the other costs. So the bottom line is, we refuse to comply with the sector rules and restrictions. We refuse. That's what we got to do. And we go back to normal. Like right now, we don't ask for permission. We don't, politely request that they just end the lockdowns. We just say fuck off. We use the words fucking off in that order. We give them the middle finger, and we go back to normal. And of course, we economically boycott and isolate the COVID enforcers and the king for life. So, this is obviously MakeMeDay.com is a Connecticut approach, but it can and should and must be started nationally for all these 49 governors. All right, a hat tip to Kristi Noem, the one sane governor in the United States. We could use more of that, but of course, they're the ones with the budget surplus, but how about them apples? And of course, there's no South Dakota-shaped casket, is there? The demands of Make Me Day participants. There's only one. It's not this Occupy Wall Street or Tea Party where we go off into the weeds. We just say one. End the emergency and the sector rules and the restrictions right now. Non-negotiable. You're doing it or we're making you do it. Peacefully, I might add. So, yes, we can peacefully escalate. Economic isolation of the COVID cops is just the beginning. Strikes are an option. Showing up at the Capitol and not leaving until the restrictions end is an option. And of course, the COVID cops and 49 governors have rapidly decreasing options and the ability to keep the population under national house arrest. So let's kind of go for a side-by-side force comparison, if you will. You people that are kind of afraid, like, I don't know, there's not enough of us, it's not popular. Like, notwithstanding the fact things do not work like that, let's go through what we have on the table, okay? You've got your NPCs, neutrals, and people who increasingly want to be left the hell alone. These are present and future Make Me Day participants, and the more these governors scream and the more they oppress, the more we're going to have support. And don't expect them to just quietly back down, because they won't. And of course, you have 49 governors and the Federal Reserve's printing press. Note, these do not actually command resources or services and require consent and asset to function. So, of course, you got the committed screamers. They're hiding at home. They're too addled in terror to support 49 governors remaking society in their own image. So, let's kind of just, compare side by side with, what we're working with. We're working with the entire hospitality industry. It's a lot of people. Construction workers, generally not for this nonsense. Tradesmen, kind of cash and carry people. They see bullshit, they call it, and they act accordingly. And so do energy and utility workers, like pipe fitters, electrical linemen. I mean, kind of, they're out there in the real world, and of course it's them, the producers, versus the social workers, the public sector, a court system too bogged down to enforce executive edicts, and administrator overlords. What an unfair fight that is. And no, dear governors, it's not a fair fight. We can and we will literally win by doing nothing. That's all we have to do is nothing. Have you considered ending the nonsense? Maybe moving it is in your future. I'd recommend it. And of course, you want us to review the list of COVID cops or hear you out. Sorry, no. You can clean fuck off. You didn't leave us alone. You didn't give us due process. You didn't make any of this up for discussion, so you don't get any of that either. And turnabout is fair play, and you're going to get it. So what does it look like to be the governor of one of these 49 states or a COVID cop? So a day in the life of a COVID cop post Make Me Day. Flat tire, tow truck won't come. It might not happen right away, but it will happen unilaterally and universally, the longer you do this. Broken toilet, plumber won't show. It's like, sorry, aren't you that fascist governor that locked my state down? You can clean piss off. Have someone else fix your toilet. And by the way, us plumbers talk to each other, so it's not happening. Going out to eat, you know those pictures of Governor Lamont and Governor Newsom and Cuomo out there not wearing a mask at those restaurants? You're not going to see those pictures anymore because the waiters and the owners will throw them the fuck out, as they deserve to be. You got picked up by other cops, like you're a COVID cop. Bail bondsman won't come and be like, oh yeah, weren't you that guy that gave that guy a ticket for not wearing a mask? Well, screw you. Sit in jail and rot. And how long does this go on? For life. That's how long it goes on. And the reason is, you want to do something permanently damaging and life-altering to somebody, you pay the price. So don't get on the list. Realistic options for you COVID cops out there, look the other way. It is the nice Christian thing to do, and it doesn't require a whole lot of commitment. And you could just quietly pretend to not see shit. That's a good option. You should do it. And of course, if you really want to be out there and you really want to scream at people and you really want to make life hell for everybody, consider your preferred choice of moving company if you want to enforce the COVID restrictions. Oh yeah, no, not the courts. You wrecked those. Best of luck on that approach. They're kind of busy attending to the other nonsense you caused, so it's not going to end up well for you, is it? So it is time to open up now, whether the governor's like it or not. Your reinforcements, you have arrived. Someone else should never be the busiest person working on the problem, and tomorrow or some future date should never be the busiest day of the week, month, or year ever. That's not how you get things done. And so, effort today, surprisingly minimal effort, is a lot better than waiting for another year of riots, selective enforcement, and more controls. And waiting for things to be more popular, easier, convenient is what caused the problem you're in. You have problems you can't vote your way out of. So resume your life. Just do it now. Take off the mask. Go see your friends. Go to church. Have regular hours for your business. Hug people. Shake hands. And do use just common sense things, for hygiene. Like, who in the hell in their right mind anyway went out when they had the flu? They didn't want to give it to grandma then. Why the hell would they want to do that now? So normalcy is back. You just have to claim it. Go to makemeday.com, and that is how we end the COVID psychosis. We're all in this together, and 320 days is too damn much. It's just too damn much. It didn't work, and this is just about control and trying to reorganize society. That's all it can be about at this point, because the data is in. And yeah, the data says none of this stuff worked like it was sold to work. So I look forward to hearing about this happening in other states, and we're just getting started. So I'll check back in, and do check out the videos for the Make Me Day Declaration and the quick description if you already didn't catch it. So take care, stay well, and let's end a lockdown, because